Migraines are one of the most commonly occurring alignments affecting the nervous system. The aim of this research paper was to evaluate the effect that migraines have on the everyday function of women. Approximately 12% of the adult population in the United States and Western Europe is currently suffering from migraine headaches. Migraines occur more often in women, with approximately 15 to 18% and 6% of the respective populations are being noted as sufferers of migraines. Scientists performed this study to see the effect of migraine headaches on the everyday functioning of women. The hypothesis is thus: the question of research was the severity of pain on a 0 to 10 scale. The study method was the research involved 125 female outpatients aging between 18 and 60 years old with a history of migraine headaches. Headache classification was made in line with the diagnostic criteria specifically by the International Headache Society. The Migraine Specific Quality of Life Questionnaire, the MSQ-V2, complied with Glaxo welcomed and made available by the Medical Outcome Trust, was used as the main diagnostic tool to assess life quality. MSQ V2 is an improved version of the first MSQ version 1 questionnaire. It assesses the everyday function of women over the most recent 4-week period of their lives. Migraines, similar to other chronic diseases, influence the psychosocial function of patients. Migraines limit the sufferer's abilities both during the onset of pain and in between migraine attacks. Acute symptoms limit social relations as well as the capacity to perform professionally and to complete different household chores. Half of the responders, approximately 51.2%, suffered from headaches 1 to 3 times a month. In the case of 42 women, which equals out to be 33.6%, the pain lasted an entire day. For 34 women, or approximately 27.2%, the pain was reported to last for 5 hours. And in the case of 19 women, which is 15.2%, the pain lasted for over 48 hours. For 36 or 28.8 respondents, the pain was located in the front to the temporal region of the head. For 60 women, which equals out to be 48% of women, the pain was located on one side of the head, whereas 30% experienced pain on the whole of the head. The majority of respondents, which is 49.6%, noted the pain at between 5 to 7 points level on the linear VAS scale, reflecting moderate severity. However, that with the increasing in the frequency of headaches, there is also an increase in the disruption to the everyday function for women aged below 40, as well as an increase in limitations in the women over the age of 40. This could be applied to public health in the sense that migraines are a huge thing. Yes, they might affect women more so than men, but when someone has a migraine, it's a serious thing. There are even good amounts of meds to stop migraines or to stop them from occurring as much. A professional application in nursing is such that when someone has a migraine headache, you want to make him or her as comfortable as possible. Your patient is going to be in a good amount of pain, and it is your job as a nurse to alleviate that pain as quickly as possible. For my own personal use, I find these findings very interesting and helpful because I am a sufferer from chronic migraines since the age of 3 years old. I chose this article to review because I, myself, am a woman who is a chronic migraine sufferer. When I personally experience a migraine, I am in the darkest of rooms for the rest of the day with a trash can within reach. When I suffer from a migraine, I am in excruciating pain and only the strongest of medications work for myself, but they do not completely relieve my pain. I found this article to be informative. I felt some of the article was hard for me to read and understand, but overall, I thought the article was well written. Some strengths of the study were that there were a good majority of women who participated in the study. I thought the article was very well written and it had a lot of good information to it that I could eventually apply in my nursing practice. The article had a very good flow to it and it was easy to understand in some points, but the other points were very hard to understand. I didn't find many biases while reading this case study, but while reading the article, I found that it was very clear that more women are suffering from migraines on a daily basis than men are. It might be that women's minds are constantly running a mile a minute, and women have so much to do between being a homemaker, a mom, and also throwing work and stress into that mix. The study tested a good amount of women to see how their migraines affect their daily life.